Hello, I'm Dr. Katanick. I work for AssociatesMD, and I wanted to share some information for our patients that use medical cannabis. We do know that medical cannabis does help anxiety, and since this with COVID-19 is an anxious period in our time, we know that a lot of people are turning towards medical cannabis to help their anxiety. That is fine, it does work, but there are some things that should be known, that when you are smoking cannabis, it can cause some inflammation to the lining of the lungs, and this can in fact cause a bronchitis or a coughing, of which can be confused with some of the symptoms of COVID. It has been recommended that people not be smoking cigarettes or cannabis at this time because it can cause more complications from if you catch COVID-19. In that respect, it does help the anxiety. You may want to consider, if you are a cannabis smoker, medical cannabis smoker, that you use other forms of medical cannabis, or maybe use baking your medical cannabis and using edibles instead, which would prevent you from getting the cough associated with smoking medical cannabis, but it does still lead to the improvement in your anxiety, though it can cause you to be high, and it's a different feeling than you would get if you were smoking the medical cannabis. The questions, of course, lead to the fact that if you end up in the emergency room, we would hope that you are more with it and able to answer questions, and please do let an emergency room or your physician know if you are using medical cannabis, because it may help in decision making as far as your treatments. So there are some good recipes online, of which you can look up, of course, and instead of smoking your medical cannabis, maybe make some edibles on your own.